and welcome to the news conference and webcast targeting harmful and underage college student drinking with NIAAA's CollegeAIM. I am Dr. Aaron White, and as a longtime college alcohol researcher at Duke University, and now as a senior advisor to the National Institute on Alcohol Abuse and Alcoholism, I can say from experience that cutting-edge college drinking research has long been a priority for NIAAA. Researchers and practitioners alike have always anticipated with great excitement any new research finding or product from NIAAA, and today's introduction of CollegeAIM is no different. Today's announcement will feature two presenters, Dr. George Koob, Director of NIAAA, and Dr. Jonathan Gibraltar, President of Wells College and Chair of the NIAAA College Presidents Working Group to address harmful and underage student drinking. Our webcast will answer several questions. What is CollegeAIM? Why is CollegeAIM needed? How is CollegeAIM distinctive? And how can college and university staff use CollegeAIM? We will conclude with a short demonstration of the guide, followed by a question and answer session with our two presenters and with some of the CollegeAIM developers who will join us by phone. You can submit questions by following the instructions on the webcast homepage. And now to begin, here are Drs. Koob and Gibraltar.
Thank you again, Aaron. I am George Koob. I'm the director of the National Institute on Alcohol Abuse and Alcoholism, and I'm pleased to introduce to you the new CollegeAIM products from NIAAA. So what is CollegeAIM? CollegeAIM stands for College Alcohol Intervention Matrix, and it was developed for college and university administrators, student life staff, and school-based alcohol and other drug professionals to help them address harmful and underage drinking. CollegeAIM was developed with leading college administrators and consists of a matrix-based evaluation tool, a user's guide, a planning worksheet, and an interactive website with additional information, so it's an easy-to-use and comprehensive resource to inform decisions about alcohol interventions by identifying evidence-based strategies. With CollegeAIM, school personnel will be able to choose wisely among many potential strategies to address harmful and underage student drinking. Next week, we will be mailing a copy of the CollegeAIM guide to every college and university president in the United States. CollegeAIM is also available in interactive format on NIAAA's college website at collegedrinkingprevention.gov/CollegeAIM.
Good morning. I'm Dr. Jonathan Gibraltar, President of Wells College and Chair of the NIAAA College Presidents Working Group. Speaking from experience, I can tell you why CollegeAIM is sorely needed. First, harmful and underage drinking remain persistent problems at colleges across the country. And they often result in serious adverse consequences for students and for their schools. Almost half of college students binge drink every month, and they're at risk for injuries, sexual assaults, and sometimes death. And even those who don't drink may experience a number of secondhand effects, such as disrupted study and sleep, or being the victim of an alcohol-related assault. Schools also bear alcohol-related costs due to vandalism, the need for increased security, and efforts to deal with student attrition that can result from sustained drinking patterns. And second, there's the issue of the intervention strategies themselves. College officials have numerous options for addressing alcohol issues, but they're not all equally effective. That's what makes it enormously challenging for colleges and universities. They often don't know what to do. And when a succession of interventions fails to work, alcohol-related problems can seem intractable, leading to questions and frustrations of how best to reduce student drinking and its negative consequences. The greatest frustration that I've heard from my peers around high-risk drinking is that it's just too big a problem and that you can't influence the behavior of college students. And I want to tell you that is absolutely false. Choosing our interventions wisely, with help from CollegeAIM, boosts our odds of success. Finally, the NIAAA College Presidents Working Group to address harmful underage student drinking, they requested a resource like CollegeAIM. Members specifically pointed to the need for a clear, easy-to-understand tool to facilitate decisions about alcohol interventions, something that would help us compare a range of strategies, understand their costs and their effectiveness, and to be able to select a mix that best meets our individual campus needs. When we first discussed this product in the working group, we agreed that we needed to do something that really mattered, something that made a difference. And if it's not going to make a difference, we all agreed that we were not going to waste our time. I think CollegeAIM is going to make a huge difference.
And in addition to these compelling reasons, CollegeAIM is needed because excessive drinking can have serious short-term and long-term effects on the developing brain. We now know that the brain isn't fully developed until the age of 25, and this is a period of vulnerable time for insults that have far-reaching consequences. In the short term, intoxication compromises an individual's decision-making processes and ability to recognize potential danger. This diminished capacity can lead to the many negative and sometimes tragic consequences we hear about each semester. Looking long-term, however, regular binge drinking by young people can compromise the development of the brain's frontal cortex. And this is the part of the brain that mediates decision-making, executive function, and this has the potential to affect cognitive and behavioral functioning even into adulthood.
And now let me talk a little bit about how CollegeAIM is distinctive and different. CollegeAIM is distinctive because of, number one, the number and expertise of its contributors. Number two, the breadth of research covered by its analysis. And number three, the convenience and accessibility of its presentation.
With regard to CollegeAIM contributors, it's important to note that CollegeAIM is the product of a number of parts, a multi-year collaboration with 16 college alcohol researchers who developed and reviewed CollegeAIM and who brought a range of expertise to the project, and an extensive review of decades of scientific literature. In a field that's known for its divergent opinions and evaluation methods, simply integrating the input from a large number of diverse contributors is a huge task, and distilling it into an objective, user-friendly tool and guide is a really important accomplishment. In terms of its breadth, CollegeAIM evaluates and rates nearly 60 interventions, some focusing on individual students and others targeting campus environment and the student body as a whole. And these strategies are analyzed and rated in a number of ways for effectiveness. They're also evaluated for costs and barriers and other criteria.
At the same time, CollegeAIM presents this comprehensive and somewhat complicated information in a quick and convenient way through two accessible and easy-to-use matrices. What I believe is special about CollegeAIM is that, well, it took a lot of time to put this instrument together. And it took a lot of time because some of the best researchers in the country spent almost 2 years studying and vetting every one of these intervention strategies, and then rating them to determine which were going to be the most effective. College officials who use CollegeAIM are going to be able to say, these are the best tested and best known strategies that work. And if you're going to try to reduce high-risk drinking, start with these. And this is what it's going to cost, and this is how effective they've been according to the scientific literature. Quite simply, it's one of the most thoroughly vetted and user-friendly summaries of intervention strategies I've seen in decades.
So how can colleges and universities use CollegeAIM? With the help of CollegeAIM, school officials can do the following. They can review individual and environmental level strategies to learn how current strategies compare to alternatives, other alternatives. They can find new evidence-based options, and they can use the interactive strategy planning worksheet to help select a combination of approaches that meets the needs of their campus and their budget.
So what's really intriguing about CollegeAIM is that it doesn't just state a strategy. When you look at the website, it's clear that CollegeAIM gets at the heart of the research behind the strategy. CollegeAIM helps you to understand not only how to implement a strategy, but what are the possible costs of implementing this strategy, and even how you should be assessing the effectiveness of the strategy. You need to find out what works in your environment. And if you're not able to do that in a way that systematically walks you through interventions like CollegeAIM does, it's going to be that same old, what you've been doing for the last 20 years that honestly hasn't led to any big changes in the rate of college student high-risk drinking.
So before we end, I want to mention a few key points. The interventions highlighted in CollegeAIM are divided into tiers of effectiveness based on an extensive research and evaluation process. The highest tier, higher effectiveness, contains 8 individual level strategies and 5 environmental level strategies. In general, they represent a range of counseling options and policies related to sales and access. The next tier, moderate effectiveness, lists additional strategies in these categories. Sometimes interventions in lower tiers may be worth considering as well, but if the schools choose to implement strategies from the lower effectiveness or too few studies to rate effectiveness, we really encourage them to incorporate an evaluation component to test the strategy's viability, to report the results of their evaluation.
And now I'd like to give you a little demonstration. So let's say after analyzing the situation on my own campus, that I wanted to review some of the environmental and individual level interventions in CollegeAIM. First, I would go to the 2 matrices, either online or in the printed guide. Then let's say that 2 of the strategies caught my eye. Let's say they were individual strategy 3 and environmental strategy 11. After seeing how they're rated, I'll need to get some more information, so I go immediately to the summary tables. Once there, you'll see additional references and resources available, so you can continue with your search. But if you've gotten all the information you need, you can then use the planning worksheet to list your current strategies, compare them to the new ones I've just read about, like the 2 mentioned here, and then find a mix that works best for my own school. On the interactive website, I can click through to access all of these elements of CollegeAIM. Either way, the point to be made is that it's simple, it's easy, it's comprehensive, and the information is credible and completely trustworthy. That's what school administrators need, and this is what CollegeAIM delivers. You know, before we conclude, I want to thank Dr. Koob of NIAAA for his institute's commitment to college drinking research and for understanding the need to translate significant research findings for those of us on the front lines. I want to especially thank Dr. Vivian Faden at NIAAA, who's led this project with an unyielding commitment to excellence and transparency. And finally, here's what's important for school officials to remember. Even in the face of limited resources and time constraints, college administrators are in an incredibly critical position to serve as a catalyst to influence a school's social atmosphere, to help address alcohol-related problems, and to make informed decisions to improve student health and safety. I know that it seems like a daunting task, but with the help of NIAAA's CollegeAIM, I assure you, it can be done.
Well, thank you, Dr. Gibraltar and Dr. Koob. And just a reminder that CollegeAIM is now available at the NIAAA college website, collegedrinkingprevention.gov/CollegeAIM. And now for some questions.
The first question will be coming in through the webcast, and the question is, Is college drinking getting worse, or is the situation improving? We seem to be getting mixed messages in the different studies.
So I'd like to respond to that initially, at least from the perspective of NIAAA. What we do know is that there has been a slight decrease in the percentage of individuals engaging in binge drinking, and that's the good news. However, the bad news is, in fact, that the intensity of binge drinking has been steadily going up over the last 10 years, and that's reflected in surveys that we've done at NIAAA to document the intensity of drinking. It's not unusual for young people to actually engage in drinking 10, 15 drinks in a bout. We know that 40% of college students have engaged in binge drinking in the last month. That's a very large number. 40% have engaged in binge drinking in the last month. And we know that hospitalizations associated with excessive drinking have dramatically gone up over the last 10 years.
Okay, thank you. Another question coming in. If you had to recommend one specific intervention from the matrix, what would it be?
From the years that I've been working with this on a campus level, there are several strategies that I would recommend. First of all, I would say that, every campus and their culture and the environment in which they exist are completely different. And so what works well in one environment might not work well in another environment. I think it's incredibly important for campuses to really look closely at the strategies that are within the matrix. But the first thing that I would recommend is that you first come to really understand the environment in which your campus exists. I would say, though, that one thing that all campuses should have in common, and perhaps this transcends the matrix altogether, you should have some kind of a campus-based working group that brings together faculty, staff, students, people from the local community, key stakeholders to really sit and talk about the issues involved in what's going on within the environment of your own campus community.
Do we have another question?
This one from the audience?
We have one from the audience, okay?
What's your opinion of the red band and other amnesty programs?
So I'll repeat the question. The question is, what's your opinion of the red band and amnesty programs that a lot of schools are adopting?
I think that we applaud, certainly at NIAAA, we applaud the efforts of schools to address these issues and using programs involving amnesty. But we really don't have any systematic evaluations of the success at this point. And we are actively engaged in discussing with the College President's Working Group ways that we can evaluate such programs. Certainly, from an individual's perspective, it's critically important that everything be done that possible to help save lives in these kind of situations.
Okay. We have another. Oh.
We have a question from the audience over here.
Can I just say it to you?
Why don't you say it to me and I'll repeat it? You want to do the microphone? That's better. Yeah.
Okay, Dr. Gibraltar, I wanted to ask whether among your colleagues in the college leadership world, outside of the President's Working Group at the NIAAA, what have you heard as far as reactions and thoughts about the tool and about whether other colleges will use it and sort of how they think it'll inform their practices?
Yes, Sarah, I think that what I've heard is that there's been a lot of desire for something that's been very well developed and that people can really trust. And so there's anticipation, there's been anticipation expressed for the release of CollegeAIM that really, when I was, as I've started in my positions as president now of my third college, you always wonder, of all of the potential research that's out there, what's going to work? And nobody's been able to really synthesize it into one place. So what I've been hearing from my colleagues is it's really great that efforts have been made to bring together some of the best research in the country.
And I'd just like to add to that that's exactly what I believe our primary mission is at the National Institute of Alcohol Abuse and Alcoholism, which is to translate the basic research, the prevention research, epidemiological research, neurobiological research into information that the public can use to improve health.
Another one coming in?
Another question.
Yeah. How will NIAAA keep this product up to date?
Well, I believe that we're going to have regional working groups that will be available for helping each area in the country utilize CollegeAIM, but at the same token, we'll be using those working groups to help update CollegeAIM as we move into its implementation. Dr. Gibraltar, you might want to comment on that.
Yeah, I think one of the nice things about CollegeAIM is that it does exist online, and that as new intervention strategies become available, the website can continually be updated to reflect the most current research available. And we're also going to ask the campuses that are going to use this instrument to help us. We need you to continue to test the strategies that are within CollegeAIM. We need to get feedback from you. So we will have regional workshops, and we'll be able to talk to you about what the strategies are, how they may best be implemented. But, you know, this is a two-way process. We also need you to give us back data about how effective they've been on your campus and in your environment.
So NIAAA will be updating this on a regular, NIAAA will be updating this on a regular basis, working with the same teams of researchers, we hope, and the same reviewers, so that we will be revisiting the literature on a periodic basis to update both the guide and the website, as was alluded to.
We have another question that came in for Dr. White or either of the other presenters. I've noticed that we're having this session in September, the beginning of the academic year, which is traditionally known as a vulnerable time for new students. Can you elaborate on that?
From my perspective, the beginning of the semester is a time when students have, and again, let me emphasize, this is not all students. This is a small number of students on our nation's college campuses. But the point is that at the beginning of the semester, when students are first away from home, when freshmen who may not be of legal age to drink or just beginning to consume alcohol and have limited experience with the consumption of alcohol, in my experience, it tends to be the first 3 to 6 weeks tend to be the most vulnerable time when we tend to see an awful lot of students transported to the hospital under the influence.
Another one that came in. What actually defines binge drinking?
What actually defines binge drinking, according to the National Institute on Alcohol Abuse and Alcoholism, is the ingestion of 4 to 5 drinks in a 2-hour period, 4 for women, 5 for men. That was established some 10 or 15 years ago as a research criteria, but it has taken on basically the elements of a definition that's used widely now in the field.
Another one from the internet. Can you talk a little bit more about the team of people who worked on this project over the past 2 years?
From the perspective of the college presidents who've been involved, this has been a high-level group of very concerned and interested college presidents who really, again, as I said earlier, wanted this instrument to be useful. And their initial premise for starting this process was, if we're not going to do it right, if it's not going to be meaningful, then don't do it. From the perspective of NIAAA, and Aaron, maybe you want to speak to this a little bit too, but these are some of the best known and most serious researchers that have been in the prevention field for decades.
That's true. We had 16 of the nation's best experts on college drinking prevention strategies to look at both the environmental level strategies and the individual level strategies. And so, these are the folks that do a lot of the research that we count on to develop strategies for dealing with this issue. And so to have their involvement really tells us this is a serious scientific document.
Okay, we have another one coming in from the web. It says, although it is nice to provide this information to college presidents, the reality is that the frontline prevention specialists on college campuses that are implementing these strategies are the ones that need this information. How will you be getting this information to those folks?
So let me start from my perspective. One of the things that I perceive to have been missing over the last few decades has been college presidents taking a leadership stand on this. We really can influence the culture on our campuses. We really can have an impact on students' behavior. And when we believe that something matters, our staff have a tendency to be more inclined to want to try to do something to impact student behavior because they know that ultimately the leader of the institution is going to be behind them. One of the things that I think also is really nice about CollegeAIM is that it's a web-based tool. We're going to have regional workshops. We're going to be making an effort to make sure that this gets below the level of president to those people who are on the ground and having to implement an AOD program on their campus.
Yeah, I would just completely agree. I believe that what you spoke to earlier, Dr. Gibraltar, about having a working group in each college campus that's dedicated to this. Most colleges actually have such groups already. We're hoping that this will just facilitate their activities and make it easier for them to look at the literature and understand what might fit best, what would work best, what would be most effective for their campus.
And just to add one more specific thing, we actually are actively applying to, at the moment, 20 professional associations and societies for college staff level folks to get on the agenda for their national conferences over the next year or so. So we're hoping that we will be able to bring this through the national meetings to a lot of the staff level folks, not just the college administrator. We have another few more coming
Sure.
in.
I'd actually like to just
Yeah,
make a
please.
follow-up comment. I think it's very important for us at NIAAA for people who will use this guide to know that we view this as a living document. It's going to be updated, modified over time. It's very hard to do something like this at all. It's very unlikely we're going to get it perfect the first time out. And so if you see something that you think we ought to change, please send us your comments, your feedback. We will be modifying this as we go forward to optimize it.
Also want to add that not every strategy that's ever been discussed is in the guide. And that was quite intentional because it had to be those that have been found to be most effective. And there were intervention strategies we talked earlier, like the red bracelet campaign. These are things that have never actually been fully vetted with research. And so it may be that as time goes on, there are other strategies that make their way into this intervention matrix. But again, what matters most is that we get feedback from those campuses that are using the matrix to impact high-risk drinking on their campuses.
It's also important to add that we chose to concentrate on strategies that work directly on reducing consumption and on the environmental side, access and availability. Right. We did include a few, like amnesty programs, bystander interventions, and safe rides for this round, even though they are more focused on consequences, so that because so many schools have those in place and there was so much interest in knowing what the research said about them. And as Dr. Gibraltar says, and as Dr. White said, this is a living document. We're planning to update it on a regular basis.
Another question coming in from the site. It says, many institutions are using external dollars to fund prevention efforts that impact retention. Do you have suggestions for how we can encourage more institutions to invest both staff time and discretionary funds to make prevention a priority?
I think I'll let Dr. Gibraltar address this, but it just seems to me logical that an ounce of prevention is worth a pound of cure here. And so that while it may be expensive to initiate such a program, in the end, I would argue that you're probably going to save quite a bit of money by not having all the problems and consequences associated with binge drinking.
It costs far more to recruit new students to our campuses than it does to retain students on our campuses. And at the end of the day, if students are not able to be academically successful because of the consumption of alcohol, or perhaps get dismissed from their schools from the behaviors associated with the consumption of alcohol, it has a financial consequence. As I look at many of the campuses that I've worked with over the years, if you think about the time and effort expended by faculty, staff, campus police, alcohol and other drug counselors on our campuses, if you take that proportion of their time that's attributed to dealing with students who have been excessively consuming alcohol, I think you'll find the cost is pretty substantial. So if interventions can have a positive impact and reduce attrition due to the consumption of alcohol, I mean, you know, let's face it, every student who comes to a college or a university has enormous potential. What a terrible consequence it is for young people who end up being dismissed from their schools because they've been excessively consuming alcohol.
More questions?
I think this might be for any of you. It says, what are the benefits of including both individual and environmental level strategies in CollegeAIM?
Well, the benefits are that we believe that a combination of those two strategies actually are going to be more effective in attaining the goals. If you're only working with an individual strategy where you're trying to change attitudes, it's very difficult to do that if the alcohol availability for under 21-year-olds is rampant. And I would say the converse is also true. So I think that if you change availability and don't address the attitudes that students have that binge drinking is the norm, you're going to end up with other avenues for binge drinking other than the local community, and that's going to fail. So I think from my perspective, from what we know about the science, you absolutely have to address both at the same time.
I would agree, and we certainly have seen that firsthand on the ground, and that is that you can educate young people using any number of products and programs about the consumption of high-risk drinking on the one hand, but on the other hand, if the community in which the campus resides doesn't also support that message, I believe that any individual intervention is not going to be as effective. You know, and in addition, in some communities, enforcement has to be behind all of this. Parents need to be involved and engaged. I speak to parents a lot at orientation programs about them being our partners and being fully invested and engaged in talking to their sons or daughters. So I believe the most effective programs are those that are entirely comprehensive.
I think those are fantastic answers, by the way. We have a question in the back. I'll repeat the question.
What are a few of the best strategies in CollegeAIM so far that you've seen?
So what are a few of the best strategies in CollegeAIM?
Well, we're not going to highlight any particular strategies that's in CollegeAIM. It's here in the booklet, and you can actually look at the ones that are most effective and the ones that cost the most and the ones that cost the least and so forth. Again, I think we would reiterate the best strategy would be to choose an individual-based intervention and a community-based intervention that works best for your specific community. I'll let Dr. Gibraltar add to that.
No, I would agree. I think the point of CollegeAIM is that there are a range of strategies, and what might work on my campus might not work on another campus. And really, people need to look at this instrument, and they need to evaluate the environment in which their campus resides, and they need to use those best strategies within the environment.
Yes, sir. You have another question?
Just to follow up on that, so what are some of the environmental factors that were tailored to the strategies that you were using?
So he's asking, what are some of the environmental factors that were taken into consideration when tailoring strategies, when selecting strategies for the intervention? Did I get that right? Yeah.
Well, some of the strategies involve, as Dr. Gibraltar just said, enforcement of the 21-year-old drinking age. There's some evidence growing, at least in certain parts of the United States, that this is not, I at least have one statistic from New York City that suggests that a large proportion of alcohol outlets are not actually carding individuals that are 21 years old and younger. I think that limiting the encouragement of drinking of young people by having happy hours or other events that stimulate drinking, half off for one sex or the other at a given time of the day, right in front of college students who are underage. I think all of these, there are many factors that contribute to community issues, and it can involve enforcement and perhaps importantly, availability. When more alcohol is available for underage drinkers, you're going to get more of the behavior we're trying to address.
Another question?
Yes, coming in from the website. We're hearing you mention binge drinking throughout today's presentation, but do you feel that the students are aware of what constitutes binge drinking?
Well, that's a really good question. And if since I've become director of the National Institute on Alcohol Abuse and Alcoholism, I have actually been somewhat appalled at how little Americans know about what constitutes a drink, how many drinks contribute to a blood alcohol level that could be dangerous, and what constitutes binge drinking. We actually have another website, which I'll discuss right now, which is called Rethinking Drinking. That's very popular and outlines all of those issues, including how much alcohol is in a mixed drink, what a blood alcohol function looks like when you drink, how many calories are in a drink, what constitutes binge drinking, and even, can point to other websites where you can get help if you think you have a problem. So I really think that it's going to be part of, I'm sure, almost any one of the individual interventions is to understand a couple of things that have to do with attitude about drinking, one of which is what we call in social psychology the false consensus effect. Well, everybody's drinking that amount, so it's okay. Well, actually, everybody isn't drinking that amount, and when you actually do the numbers, you find out that some of these attitudes are absolutely false. The other is to understand what are the consequences of drinking, not just the fact that you can't remember where you were the night before, which is a very good marker that there's a problem. That's called a blackout. But the other problems, maybe you're always late to class on Monday morning. Maybe your social interactions are deteriorating because nobody wants to be around a person who's intoxicated all the time. It can extend in all of those domains.
So I would add that one intervention that I have found to be extremely important is that all college freshmen incoming to their campuses be required to take an alcohol prevention course. And now that could be an online course. And there are many products out there. I'm not going to highlight any one of those products. But what I will say is that those courses will walk you through understanding consumption, everything that Dr. Koob just talked about. And there is data that says that as students go through those programs, it actually does change what they know, and they actually do change their behavior and their consumption. A lot of campuses use these online programs as judicial sanctions. So if a student gets in trouble, then they have to take the course. I think that's too little too late. I think all students should have to take it within the first week that they come to our campuses.
Do we have another question?
There are no more from the web, and if there are no more from the room, we were hoping that we could just get a final parting comment from each of you.
Sure.
Aaron, starting with you. Thanks.
Well, we want to thank you for tuning in. We know that everybody is busy and there's lots of competing interests for your time. We hope that you found this informative. We really hope that you visit the website, look at the guide, see what you think, and please send us your feedback so that we know how to modify it and improve it moving forward. So thank you.
I want to thank Dr. Koob and NIAAA for their diligence through this process. I realize that this has taken a couple of years to produce this instrument, but I will say that this is probably the best data and information that's currently available. I hope college administrators, faculty, staff will use this instrument and that they will give us feedback as we launch this across the country.
I'd just like to thank my staff who've worked so hard on this, and particularly Dr. Vivian Faden, but I also want to thank Dr. Gibraltar and all the college presidents who have participated and worked so hard on these issues. And I guess my final comment would be that I hope that the individuals, the citizens in the United States will understand that this is why we're here, the National Institute on Alcohol Abuse and Alcoholism. We hope that this kind of evidence-based translation will continue in other domains. We hope CollegeAIM will be a prototype for doing similar things, perhaps in treatment and other elements of prevention and intervention. So thank you very much.